Welcome to Conversation with the Community Leader, brought to you by the Leadership Kitsap Foundation. I'm your host and Leadership Kitsap alum, Dave Walters. With me today is Dr. Kreidler-Moss, CEO of Peninsula Community Health Services. Jennifer, thank you so much for coming.
Thanks for having me.
Peninsula Community Services was founded in 1987 as a clinic in downtown Bremerton, and then in 1995 qualified federally as a health center. PCHS includes, I have to look at my notes here. PCS includes primary medical, dental, behavioral health counseling, substance use treatment, pharmacy services, health education and promotion activities for all stages of life. Their services are provided to all independent of their insurance or financial needs. And I hear we're also a little bit in the housing now, so I'm excited to hear about that. Some interesting facts about PCHS. Since 2017, they have opened a dental clinic, one per year. They've stepped in to fill emergent needs in our community. For example, when Kitsap Children's Clinic closed, within 1 week of them closing, Peninsula Community Health Services Children's Clinic opened up in the exact same facility. So a very dynamic organization. And they have partnered with Kitsap County Sheriff to provide mobile medical care to incarcerated youth. And recently, they operate a jail transition clinic. So a lot of things to talk about. But Jennifer, before we talk about that, I want to talk about you. So are you originally from the Pacific Northwest?
I'm not. I actually grew up in New Jersey and made my way here through a series of events that landed me here, where I did go to school here. So,
but you ended up getting your undergrad from Seton Hall.
I did.
New Jersey.
Seton Hall, New Jersey, and then
And what did you study there?
Physics and chemistry.
So, what were your plans to do with that?
I was going to be a scientist.
Okay.
I don't consider myself much of a people person, so I was going to study become a lab scientist, and do that for life. Which took a left turn when I decided to become an oceanographer, because when you're from New Jersey, clearly you want to live by the ocean forever. So I went to graduate school in Hawaii, and from there landed here by way of getting married to somebody who was in the military, and came here into Washington State. And then I applied to the University of Washington for oceanography, and missed some deadlines. And so as it turns out, when you have a degree in chemistry and physics, you continue to go to school. So I went back to school and landed in the pharmacy department and became a pharmacist.
And you did that at Wazoo?
No, I did that at University of Washington.
Oh my gosh, I'm so sorry. Okay.
It's okay. As it turns out, I am both a Husky and a Cougar.
Did you have your MBA?
I did, from
Wazoo. Okay.
So I always win the Apple Cup, and makes me popular with both sides of the state.
So I'm assuming you weren't planning on being a healthcare CEO.
No.
So how did you get to this role in your career?
So I ended up, I was a student actually at Peninsula. And so that was one of my rotations when I, was a pharmacy student. And then I became a hospital pharmacist for a couple of years, ended up coming back through some military moves. And I landed at Peninsula and started our clinical pharmacy program. I was going to work there for a couple of years.
And what year was this?
2003.
Okay, so you've been with them over 20 years.
21 years later, I'm still there. And actually what happened to me is what happens to a lot of people who work in community health. If you're not really familiar with the exact thing that we are at Peninsula, we're a community health center. What that means is we take care of the community. If we're doing it right, we listen to what's going on in the community. We have our board of directors has to be at least 51% of our board has to be active patient users. And what we do is we fill gaps in the community. And so what happened to me was I kind of fell in love with that model. It feels really good to go to work every day. And a lot of people don't get to say 21 years later that they still love what they do. So I started in pharmacy. I then became the COO of our organization for a couple of years. And then when our legacy CEO, who is a great individual, retired, I became the next CEO. And so I've been doing that now, going on my 8th year.
Okay, so why Kitsap County? Because you said you actually were here as a student and then left. So why come back to Kitsap County?
Kitsap County. Kitsap County is big enough to be big, small enough to be small, and it just happens to be a great place to get stuff done. I think when it comes down to it, I feel like we can make a difference in Kitsap. I feel like it's a great place in healthcare where there's enough resources to get things done, but not too big that we can't get things done as well. So I love Kitsap. At this point, I have 3 teenagers, all of whom were born here, all who are from here. We're actually to that stage of life where we're looking at colleges, and it's a big decision for them to decide if they're going to go, stay, come back, and what that looks like. So Kitsap's home now.
Oh, exciting. So in researching for this, I found PCHS services are far more diverse than I have ever known. I mean, once I started looking, it just kept getting deeper and deeper and deeper. So what are some of your primary services?
Yeah, so I mean, we have since our inception, we've been a medical clinic system. That being said, in the community center line, we look at what's missing. And so dental is the next big service line that we grew. And still, the community need for dental in our area is huge. So we continue to grow dental on a regular basis. And you referenced that in the beginning. We, continue to build dental clinics at a regular pace. Along with building dental clinics, we actually build dental providers. We have a dental residency program for dentists. We have dental assistant apprentice programs to build dental assistants. And so we work a lot in that space of dental. Behavioral health kind of became the next thing we did over the last 8 years or so. We have both a mental health component and a substance use treatment component. And so in that space, we do providers where they've finished school, but they need hours to continue to be independently licensed. And so we bring both of those provider types on and work with those. We then pushed both of those programs and we run a bunch of school-based clinics. And so we help offset the gaps in the school-based clinics to make sure we can get those services to kids. We work really closely with Kitsap Mental Health along with the independent providers in those spaces. And so we kind of fill in part of the network there. Mostly patients that don't need as intensive services as Kitsap Mental Health can offer. And so, then we grew into that line. So that's probably like our third biggest line there. And then it just kind of keeps going. I came in to do pharmacy, and so we have several pharmacies located throughout the system. And we're able to offer patients low-cost medications through programs that exist just through our community health center system, because that's, it's special programs for those patients that use our system.
So where are your centers physically located?
So we go all the way from, in Kitsap, we go from Kingston through Paulsbo, through Silverdale, several through Bremerton. Then we go down into Port Orchard, and we actually have one out in Peninsula, so we do touch into rural Pierce County. In Mason County, we are in Belfair and Shelton. Our schools, we're in all of the school districts except Bainbridge. So we're in North, South, Central, and Bremerton. And then in Mason, we are in Mason County school systems down there. And then we have a bunch of mobiles. So we have 12, I think, mobiles now. So we take our mobiles all through our entire service
That
area.
mobile seems like a lot of flexibility.
Yeah.
And multi-use for that.
Yeah, we started with one. We thought that'd be a great idea. Like I said, we're up to 12 now. And so our mobile programs are extensions of all our programs. We run medical, dental, behavioral health, and then a lot of enabling services. So we go to the outreach events, we go to fairs, school fairs, education fairs, all of that as well.
How many employees does PCHS
About 400.
400. Wow, that's a lot bigger organization than I think people know.
Yeah, and it's really varied. I mean, in addition to the main service lines, we also, for the county, Kitsap County, we do the insurance eligibility work around both Medicare and Medicaid. So we help people who aren't even just our regular patients. We just help the county's patients just in those spaces of insurance eligibility.
Do you have volunteers also?
We do. We have volunteers in the Medicare space for the SHIBA program. We have some volunteers who just come into our clinic and help, with access and those kind of things. Our board is all volunteer, as we talked about. And then we have both our patient side and some community member side. And then we had a lot of volunteers during COVID. So during COVID, we had stood up a lot of the vaccine clinics that were in the area. And so we had a lot of volunteers then. We wish we had more volunteers. So that's a program people can help with.
So what are some of your PCHS's biggest challenges?
Oh gosh, healthcare is just a challenge right now.
It is. It's
Oh,
tough.
it's terrible.
I mean, there's a worker shortage. I mean, it's a trained worker shortage. So how's that? What's the reality behind that challenge? And then you've already alluded to it, but what are some of the exciting things you're doing to fill those gaps?
Yeah, so I mean, healthcare is just hard. That being said, it's also exciting. I mean, so with every, all the challenges come opportunities as well. So we do a lot of work in workforce space trying to help make employees. And so I don't think we ever saw ourselves, be great employees just grew on trees, but they don't. So we have to make them. So we have apprentice programs in medical assistants, dental assistants. In the professional space, we have 3 different residencies. We have dentists, we have pharmacists, and we have psychiatric nurse practitioners. It's great to watch people try something out sometimes, which it doesn't always stick. Sometimes people want to try it out. They don't love it. It's okay. It's healthcare. Healthcare's hard.
So what kind of experiences or education do you need to start off with your apprentice program? Because that sounds kind of interesting.
Yeah, actually none.
Really?
Yeah, none.
Off the street?
So we look for, we run ads. We have different cohorts come in. They interview. We're looking for people who are excited about it, want to give it a try. We do usually ask for a service commitment on the back end. So we'll pay for you to go to school, but then we want you to work for us for a year.
I mean, homegrown employees, that you can't really beat that.
Yeah, and a lot of people take to it. And a lot of times you can grow within our organization too. So our medicals, you can come in, you can work at engagement for a while, see if you even like healthcare, if it kind of jives with you. Then you can start the apprentice programs, try it out, work for a little bit. And then for us, our mid-management are usually our working staff who've worked for us for a while. So you can make a career out of it. And a lot of times too, our employees go off and then work at other places in our community, and that's okay too. It's just there's a workforce shortage in general in Kitsap. So, we have a higher turnover than we'd like. But that being said, if that's what we're committed to as a workforce agency, we expect that people are going to go off and spread their wings, and a lot of people actually come back. So for us, sometimes we're not able to pay the highest salary, and that's just a reality for us. We have to balance staying in business and also expanding.
Because you are a nonprofit.
100%. All our stuff goes right back into, that's how we expand. And so you kind of alluded to like our new housing program, for example.
Yeah, I'm excited to hear about that.
And so, if you'd asked me a year ago, 18 months maybe at this point, I'd have never thought we'd have become a housing provider. But what we find when we talk to our workforce and we talk to our patients is that that's what they're really struggling with. They're not able to stay well or keep jobs because they can't find housing. And so we actually have both housing that's permanent supportive housing that's coming online for patients with medical needs, as well as we have workforce housing that's now coming online. And so we have those programs that we're funding directly out of Peninsula dollars and some grant money. But we have those programs because we're filling that need now in our community. And so that's what's nice about kind of going back to Kitsap, why us? We're able to be nimble, we're able to be flexible, we try some things out. They don't always work, right out of the box, but we work with it, and figure it out. So it's exciting.
So what's next for PCHS in the upcoming years?
Yeah.
Of course, you already said that 18 months ago you wouldn't have thought housing.
Right. Literally, housing is right now.
Housing's right now. What's the next gap that you see for our community?
So our biggest couple things, our medical legal program is about to launch. So we've developed what's an internal mini legal firm, brand new to us. Actually, pretty new across the country for.
Is that modeled from other organizations?
Yeah, we're on the forefront of this one. So there are it's called a medical legal partnership, and they do exist across community health centers across the country in a real small format. And usually what you do is you refer people off for legal services. We do have a relationship with Kitsap Legal Services. They're great. They've been working with us. But what we found was we still had some gaps where we wanted to work with some other patients and do just more work more frequently. So we've now hired a team within our own organization, and we'll be doing that work. We've had to kind of figure out how to do that, what it looks like to have a legal firm within our company. So they already do some work with helping patients with evictions, notes for not getting their utilities turned off, and that kind of stuff. And so we're going to be taking that one step further in the next month or two. So that's new and hot off the presses.
So what are some of the misconceptions, or what would you like the community to know more about PCS?
Peninsula, honestly, I think
I'm going to go
there's,
with Peninsula now. It's easier.
yeah. I think some people, if you've been around a long time, you probably still think Peninsula is where you go when you have nowhere else to go. And it's changed quite a bit. We actually, the typical Peninsula patient now, I don't know that there is one. So we see patients who still don't have insurance, and we will make sure that you can get seen and pay for it. And if you can't pay for it, we have a way to help you with that. But we see tons of working people who just find it's easier to access our clinics because they're close to their work, they're close to their home. They have a whole bunch of services all in one place. We see a whole bunch of retired people because it's easy for them to get in. They're used to different providers who've worked for us. So in addition, I've worked there 21 years now, but we have a lot of providers who've worked for us 15 years, 16 years, 20 years. So they've been with a provider for a really long time. We have patients who have just found us because who knows why they found us, but they're real comfortable there. So I don't know that there's really a typical patient anymore. It's just everybody. And there's no reason to leave, whether you have insurance, don't have insurance, your insurance changes. We just take everybody now. So I think that's probably what's most surprising is it's just around to serve the entire community. And the best thing people can do who probably want to help is just come to the doctor, come to see our providers. So, we are not funded hugely by grants. We have a grant, we have a federal grant. That's what makes us a federally qualified health center. But the majority of our revenue just comes from patients who come in and get seen and pay their bill and just continue on in a normal fashion. That's what makes us happen.
Oh,
so that's the secret sauce. The secret sauce is just come be a patient. And if you can't pay this time, don't worry, we'll take care of that too.
So I want to dive into leadership because your organization is very unique from other organizations. And like you said, you fill the gaps. So you have to constantly look for upcoming gaps. One, you have to then pick which ones to go do. And then you have to figure out how to fund the darn things. So you're problem solving and innovation. So what kind of tactics do you as a leader use in such that dynamic organization? And I know it's a mouthful, but
yeah, no, I think we listen. We really try to listen. We try to listen to our patients. We try to listen to our staff. We try to listen to the community. We try to really work with who else is out there too. We don't try to do things just because somebody else is already doing them. We're not a Me Too. We really try to figure out how to fill in what needs filling in and not step on other toes and work really well with people. Our community partners are great.
So you say community partners, and really these are other organizations that you have to tightly collaborate with. So one, you're competing for funding dollars, you're competing for patients, but you want to not compete, you want to fill in the gaps. So how does working with the other organizations, how does that flow in Kitsap County? Because I know Kitsap County has a reputation for our leaders working well together.
Yeah.
How does that come to be?
It just does. I think people communicate well. I think honestly, there's probably a misconception generally that we don't, and I think it's unfounded. I think we really do communicate well. I think people get along really well. I think people check in with other people. There's some general social to it. There's some breakfasts that happen. Mm-hmm. There's some after work dinners. I think our typical work day for a lot of people is probably about 6 a.m. till about 6 p.m., 7 days a week. We probably don't talk on Sunday. So maybe 6 days a week. But I don't know anybody that I can tell you right now who I interact with that doesn't like what they do. And I think maybe that's part of it is the right people in the right places. And generally my staff, my leadership team, they're great. They like what they do. And I think maybe that helps a lot, is that I don't run into many people who are unhappy.
So it also sounds like you build that environment or you help build that, maintain that environment.
Yeah, what maybe I also feel like I have a real good support network and in community partners, I feel like I can call someone when I need a moment or have a moment or I say like, is this crazy? Like, am I like, like I need a check of what's going on. There's some really good people around town.
So who influenced you as a leader, and did you have a mentor?
I think well, as much as our local community is really available, I think community health centers is a small enough group that I've had a lot of people in the community health center movement. So in our state, there's 27 of us. I think they're a really accepting group that I've been able to work with through
Because you're all
the years.
experiencing probably the same challenges.
Yeah, in probably different parts of our state. And then there's right about 1,500 community health centers in the country. There's 27 in our state. So there's a lot of support kind of through all of that. I think locally, I've watched some people retire here in the county through the years. And so that's been kind of nice to get to know them and the new people. And yeah.
So what advice do you have for emerging leaders looking for a career in healthcare?
Oh, healthcare.
Probably not go to oceanography school.
I don't even, I think,
or do you recommend oceanography school?
You know what? Never say never is what I tell people. I tell people never discount an interaction with somebody. You never know when you're going to meet them again.
Oh, that's golden.
So I have people who come up to me all the time who I'll meet in a new setting and they're like, yeah, I talk to you whenever. And I'm like, oh, I may or may not remember, but the human interaction is real. I think it's super important to always remember you might meet somebody again. And yeah, so I never knew I was going to do the job I do, but I do it. And I think it's great. I think if you're unhappy in what you do, find something else. Don't spend time being miserable. If you don't like it, you got to figure it out. So I'd say that. I think to people, if they're unhappy, find something that makes you happy.
How do you develop yourself, and then how do you develop your folks around you?
So I'm still a learner. I'm definitely a learner. I've gone to school. You alluded to. I went and got my MBA a couple of years back. I'm looking at pursuing law school right now. I may try to get into law school.
That's a little more alphabets after your name.
I try to leave a lot of those off. I think it's more about just being engaged with a group of people who might think a little different sometimes, and that helps. So I enjoy that. As far as working or engaging people around me, I'm up for a good debate anytime.
Okay.
I'll debate just about anything. I may be wrong, but I still debate.
Well, that's where the best answers. That's how the best solution is developed. Right. So our time is done. Isn't that crazy how quickly that went? So I'd like to thank you for all the amazing things that Peninsula Community Health Services does for our community. And thank you for being the amazing leader that our community needs. Your innovation, problem solving, and collaboration, I think, are an example for all leaders. So please visit pchsweb.org and leadershipkitsap.org for information about both of these amazing organizations. Thank you for joining me, and I look forward to another episode of Conversation with a Community Leader.